Hello, good to see you today. I'm Dr. Philip Umschner at the Ozark Chiropractic Clinic, and I'd like to welcome to our video this week. Today, we're going to talk about pillows. Patients a lot of times will ask me, what pillow should I use? What's comfortable? What's the best for me? Because a lot of people spend a lot of money on pillows trying to find that right one that feels good. I think anybody knows that if you've had issues, with your neck and it hurts, finding something that's comfortable so that you get a good night's sleep, it's hard. And it's important because, face it, if you don't sleep well, that affects your job the next day, it affects your relationships, it affects just how you feel. And that's not worth it. You need to be in good shape. So let's talk about pillows and stuff. First, we need to understand a little bit about what we're looking at pillows and what we're trying to help and prevent. So we're going to learn about the spine a little bit here, show you. So we look at your spine from the side. This would be the front of your body. Back here. There's some curves in your spine. Your neck will bow forward, the middle back goes back, and the lower back forward again. These are what make up our postural curves. They're very important. They help keep us in good upright position. They place the least amount of stress upon the joints, the nerves, the muscles. Things move easier, they work better, and you feel better. So that's important that we help maintain these curves. Oftentimes, when we sleep on a pillow or your head's propped up, that curve is stretched out like that. So that puts that much more pressure and pull upon the spine, and that's not good for us, so we want to avoid that. So what do we look for in a pillow? Well, we like to use the cervical pillows here. I use one personally, and here's an example of what we're talking about. And stuff, as you can see, they're shaped different than a normal conventional pillow. What you'll do is, when you lie on it, your neck will go over this part here, the head rests here, okay? We have two different thicknesses. This side is for smaller necks, which most people would fit on. This is for the bigger guy. When you lay on your side, it's here is regularly built up for you like a normal pillow. So it supports the head in a straight line. And that's what puts that curve in that normal position. And that's very important. So that's what we're looking for and stuff. I'll show you an example of what a spine looks like. And this is one without the curve. This is the front of the neck and the back. Now normally the curve should be bowing this way. And you can see this curve is straight. So if you put that on a pillow that props it forward even more, it's going to cause that much more pull or strain upon your neck. And that's what we want to avoid. So it's very important that we find a good pillow. How long should pillows last? That's a hard one to say. I think it all depends on, how well you take care of it. How clean does it stay? Some of them, they say you can wash. I've never done it, so I don't know exactly how well that works. But yeah, I think you're looking at 2 to 3 years, you probably need to be thinking about replacing it or just checking to see how much the loft is, if it hasn't gotten too compressed. That needs to be replaced, so you have to look at it that way. There's all different kinds of things out there, and I always tell patients, if you got questions, call me. You don't have to be a patient to call, ask a question. I'm always open. Reach me at 667-5053. Check out the website, ozarkchiropractic.com, the Facebook page, like it, share it. And another thing on that is, if you've got a question, if there's a question you have, send it in to me on that Facebook page. If there's a topic you'd like to see me do a video on or have questions about, please give me ideas, because I'm always looking for something to do to improve. I want to make it interesting. I want to make it enjoyable, something you can pick up and learn and be beneficial. So with that in mind, if questions, again, give me a call, 667-5053. But until next time, thank you.